Money FM 89.3, best of weekends.
Happy to have Dr. Jade Kwa in the studio with us today. Jade is a senior pediatric emergency specialist here in Singapore. And Jade, thanks so much for coming in today on Money FM. And, first off, got to ask you, how are the emergency workers all faring during COVID-19?
Thanks for asking, and thanks for having me here today. This door's gone orange. We've just come to the end of the third week now. And I have to say it's getting quite tiring with all the new procedures and protocols that the doctors have to follow. So I think really the challenge now is to continue doing the work really well and with our morale high, because the only way we're going to get through this is together.
And just a bit of perspective, I think, for our listeners. How has it changed for doctors, nurses, yourself, in the front line every day? How has it changed?
Okay, so one of the big issues is how infectious this virus can be. So we try to reduce contact within the teams as well. So previously we used to have overlapping shifts. So there'll always be someone fresh on the floor to see the patients because the A&E is 24/7. Yeah. But now we work in modular shifts. So we're with the exact same team for 12 hours a day. And then when you leave, an entirely new team comes in. So that minimizes spread between the teams. And what that essentially means is that you're working a lot longer hours. That can get quite tiring.
So what was it? How many hours before versus how many hours?
For the junior doctors, they used to do maybe about 8 hours. Yeah. And every hour there would be a new team coming in or a new person coming in. But now we're all doing 12-hour shifts. Yeah. We all start to end at the same time. Obviously, we have to don extra precautions when we see our patients. Yeah. And these are great practices to prevent spread. And healthcare workers are usually at quite high risk of mounting an abnormally large response to a virus. So this is really good for us. But it's also very tiring because you have to think about, the gown you have to put on, the hat you have to put on, what kind of mask to wear in what situation. I'm sure that it will get easier once we get into the habit of it. But at the moment, it's just something extra we have to think about while we're seeing these particular cohorts of patients on top of the business as usual patients that we have.
Yeah, and then that was a question I had, as you call it, the business as usual patients. Do you have to wear the same surgical gowns and precautions?
No,
take the same precautions?
Thankfully we don't have to, because honestly it's quite a lot of disposable gear that's coming into play here. Yeah. So if it's a patient that's at relatively high risk of having COVID-19, then we might wear a yellow gown, we might wear a scrub cap, we might wear, our goggles and a different kind of a mask, an N95 mask. Yeah. But if I was seeing somebody who was in for, say, just a broken ankle and declared that he didn't have a fever or cough, I'll see him in a separate area and I might just wear maybe a surgical mask. Yeah. Well, so that declaration is quite key, actually.
Yeah, the declaration, absolutely. Logistically, I'm assuming, because like most people, I'm avoiding medical facilities for obvious reasons, not to burden you guys any more than necessary. So the moment that someone shows up with possible symptoms, they're immediately funneled and taken off somewhere else.
Yes,
Is that
that's
how
right.
it works?
We have screeners who aren't necessarily our regular healthcare workers, but they've responded to a call. So they come down and then they help the system. And,
kind of triage type?
Kind of, yeah. Well, some of them, I met a couple of them the other day. They're like Republic Polytechnic students. Oh, wow. And, so they're taking on this new job, this new part-time job at the moment. And so they're the front line. Now, they're screeners. They have a certain set of questions they have to ask, usually related to whether you have a fever and travel history. So they're just, they're literally doing their job, but sometimes they get yelled at because patients or caregivers are a little bit upset. They feel like they're being accused when they're asked questions, or they feel like time is being wasted. But it's really not, because when the screeners are able to do their job properly, then the patients are cohorted into the correct area to be seen, and then things can move more smoothly than from there on.
I mean, we can talk about the abuse, unfortunately, some of you guys have been experiencing a little later, but let's praise first. They are heroes, aren't they, these guys? Because you all are, but they're at the very front line, aren't they? So they're at the first line of possible exposure.
That's right.
Meeting these people, and they deserve a lot of credit, don't they?
Absolutely. I mean, I think from this whole COVID-19 experience, what I'll remember best is how well the whole team had to work together. And I'm not just talking about the doctors, but with the nurses as well. And obviously with our new friends, the screeners, who are really only here to fill in this role in this particular time.
And a thankless role, let's be honest.
Yes, and even the housekeepers. The housekeepers are the ones who have to clean up the mess. Everyone's always worried about fluid and droplet spread, but these are the guys who have to clean everything up, and I'm so grateful for them.
Jade, how have the patients been treating the staff? When you were there, you said sometimes when they're talking to the screeners, they get a little bit maybe short-tempered or don't want to deal with it. Are the patients' nerves a little bit frayed at this point too?
I think everybody's nerves are frayed, to be honest. Yeah. So I think...
What do we need to do to right that wrong in terms of the patient's actions?
Sure. I think we could all, including patients, afford to be a little bit more patient and understanding because, every day we're getting more information about the virus. And so we're adjusting to make the hospital the safest place for the patients to come to.
For everybody, right?
Yes, for everybody. So it may seem like some of the rules, a patient may feel like it doesn't apply to them. I've come for a broken ankle, for example. Even if I have a cough, it doesn't apply to me. I can't possibly have COVID-19. But, in times like that, when it's very, very sensitive and surveillance has to be high, it is important that you declare that and that you declare it honestly and then let the triage nurses or senior doctors decide whether or not you might, in fact, be able to be seen in a non-fever, non-cough area. For example, maybe if you have a long history of sinusitis and you're always coughing, coughing like that, and you don't have a fever and really have come for the broken ankle, we might view it differently. But let us decide. Just declare it honestly and let us decide.
And the good news is, look, let's praise our medical services. It's working. Yes. We're not out of the woods yet. We know that. Still a long way to go. But we're receiving all kinds of praise from around the world, from the World Health Organization and from other countries.
Yes.
The words gold standard keep coming up.
That's
other
so
countries are now looking at Singapore's health facilities, looking at our screening processes to see this is how it's done.
Yes.
And you made a good point there when you said about, we shouldn't, but we sometimes forget that healthcare professionals, doctors, nurses, cleaners, are at the front line.
Yes.
They are at the most risk. But touch wood, we seem to have managed to avoid what countries like China and I think South Korea have had, which is doctors themselves catching it, nurses catching it. What have we done differently to other countries that has so far, touch wood, protected most of our healthcare professionals? What are we doing differently that's working?
That's a really good question. I don't think I've had time to analyze that. I mean, I would say probably just, my heart goes out to all those doctors in China and, the teams in South Korea who have been so, badly affected by this. And I'm not taking anything for granted. I mean, like literally my new normal is that every day when I wake up, I'm so grateful that I'm still well. Wow. And when I come home from work, I'm just very, very conscious of not bringing anything back home to my kids as well.
Yeah.
So, I think what people might forget is that healthcare workers we're humans too. No, but also we have families.
Absolutely.
And we are at great risk of catching something on any given day, like be it hand, foot, mouth or chickenpox or measles or something. But on this particular time, in these particular times, we have to be like super careful. And so we are. So I think what Singaporeans are really good at is listening to our bosses. When the bosses say, look, go to this area and put on all this extra protective gear, even though it's hot and uncomfortable, we'll go, okay, we will do that. And so we do. And maybe that helps, maybe all these years of being obedient have finally paid off.
Being kiasu works.
Yes,
right?
exactly.
It works. And let's hope it continues to work.
But Jade, I mean, also you lived through and worked through the SARS when it was here.
Yes, that's right.
And certainly there were a lot of lessons learned during those days that have been implemented.
Yep.
What are some of the key takeaways that you've seen personally over your course of?
Well, during SARS, it was my first year of work. I was a houseman. And I remember being so overwhelmed and bewildered because it was my first year working as a doctor. It was all the long hours. It was really nothing like what they portrayed on TV. There was nothing glamorous about being a doctor at all. And then SARS happened. Yeah. What I remember was that there was a lot of fear and uncertainty. We certainly had some mortality and morbidity amongst the healthcare workers, which was very sad for everyone. And what I realized is that this time around with COVID-19, for example, we've actually got a DORSCON situation. So that arose out of SARS. So I think people are better prepared. They've learned from their lessons. They may have been able to prevent all of the deaths and all of the morbidity from SARS, but we took lessons from that into COVID-19. And surely this is not going to be the last pandemic that we face. And so surely, whatever negativities are rising out of this, hopefully we can be resilient and recover as a society.
That's a very interesting point you make there, Doctor, because as we're sitting here, we're not getting smug, but we are trying to learn from the lessons of SARS and we are trying to contain the virus. And we've discussed this. As we look at the rest of the world, I've been sitting here for the last 2 or 3 weeks thinking the rest of the world is not necessarily reacting as fast as we did to contain the virus. In the healthcare profession, how are you guys looking at the rest of the world? Do you think that they're doing enough? Do you think more can be done? Are we going to contain this thing? Nobody has a crystal ball, but from a healthcare point of view, how are you viewing what's happening in the rest of the world?
Well, I think transparency is very important. So I think it's wonderful that some neighboring countries have declared they don't have any cases of COVID-19, but it would be even more wonderful. Yes. But I think it would be even more wonderful if everybody could be a lot more transparent. And the reason is this, it's because when you're trying to learn about the disease, which is, the viruses, they can mutate, they can change so easily, they can adapt. So we need to catch up as well with all of that. And we can only do that with data. When people are not transparent, we don't have data. So we don't even really have an idea of the true number of cases, in the world. And that could make a big difference when you're talking about the percentage of mortality.
Great point.
So I think it would be so super if people were upfront with their data and willing to share it during this time rather than, for example, hanging on to it for whatever reason that people do that. Yeah.
Jade, thank you so much for being with us and giving us this inside look and what's happening with the healthcare workers and the people that are really on the front lines of taking care of COVID-19. Really great to have you with us today.
Thank you. Thanks for having me.
To listen to more great interviews, download our podcasts at moneyfm893.sg or download the SPH radio app available on Google Play or the App Store.